Good evening, everyone, and welcome to our fourth podcast episode. I'm Alex Kimbrough, your host. Each episode will be interviewing passionate professionals and students. Whether you're a student, an early career professional, or a veteran in the field, after every interview, you will have learned something new about public health and the warriors that fight the good fight every day. This podcast is funded by AHEC, the Area Health Education Centers program. AHEC is a federally funded program established to improve the supply, distribution, and retention of quality of primary care and other health practitioners in medically underserved areas. AHEC provides support services for information dissemination on healthcare issues and participates in the collaborative community-based research. So tonight we have a special guest, Dr. Tiffany Ford, a public policy and public health researcher. Welcome to the podcast, Dr. Ford.
Hi, thank you.
Thank you for being on tonight. So, like I said, we have a few questions for you. I want to have this be very discussion based, and I really want to get to know more about public health or public policy because I don't know anything about it. My background's in epidemiology, so I'm just all numbers and data. But I really do. I've always wanted to get at least a little bit of a dabble in public policy, because we talked about it briefly at school, and we may have one class for 30 minutes in that subject in that class where we talked about it. So I'm really curious about what you do and what your experience is. So my first question is then, what do you do? Is public policy researcher a little bit too broad to describe you, or what do you think it is, or what is it that you actually, do on your day to day?
Well, first, I want to thank you again, Alex, for having me here on the podcast. I love AHEC. I love the work that AHEC does, and maybe a little bit later in the discussion, we can kind of talk about sort of my previous experience with AHEC. But jumping into just this broad conversation of public policy, I would say calling me a public policy researcher, honestly, isn't even broad enough. I consider myself, I consider myself both a researcher and an advocate. And in my work, I'm really bringing together the field of public policy and also the field of public health. And I feel like a lot of times folks, when you say public policy, they're like, I don't even know what that is. And the truth is that it's not even as deep as it sounds, right? Policy is everything. It's everywhere. It's the rules, formal and informal, that we all live by. But then, of course, there's the official, public policy that you might think of at the sort of state or federal level. But there's policies within institutions. There's policies within health systems. And really, my work targets policies at each of these different levels. So like I said, I consider myself a researcher and an advocate. So when I think about me, when I think about the work that I do research. So I read a lot, I write a lot, I discover new information by, digging into quantitative data sets. I do qualitative work. So, having conversations with people, interviews, focus groups, all of that sort of work. All of that is public policy work. And that's my work as a researcher, but I'm also an advocate. And a part of what it means to be an advocate is, making these sort of policy recommendations at each of these different levels that we talked about, right? So institutional, broader systems level, state, local, even federal level policy. I bring people together across different issue areas and sectors, which is especially relevant when we're talking about public health and the social determinants of health. Because you talked about being an epidemiologist, and we can say, even within the field of public health, sometimes folks are not necessarily on the same page with what each of us is doing. And so just imagine, as you sort of go out even bigger than that, there are folks who don't even see themselves as a part of public health, folks who work in housing, folks who work in the education system, folks who work on transportation issues. All of that, in my eyes, is public health, because all of that impacts the health and well-being of individuals. And so a part of individuals and of communities, right? And so a part of the work that I do is bringing folks together, helping them to see the ways that they can work together, should work together, helping them to see the ways that they're really talking about the same things for the same people when we're having conversations about addressing health inequality. And specifically, my work tends to focus on race, gender, health inequality. And I tend to look at how gendered racism is operating to shape the health and well-being of people in the US. And like all these different sectors are needed to have that conversation. We need people from every aspect of the social determinants to be at the table to have a conversation about what it means to reshape policy to support our health and well-being. And so I would say that's the work that I do.
Wow, that's a very, very detailed response. But I like like it's true. Like policy is in everything. Like everything you do, like there had to be a law and a policy and opinions and data, and you have to meet people to bring people to the table to even come together to make an agreement about something and how to do processes. And
I mean,
I
think
can,
about it like at your own house, right? Like you had rules growing up; those were the
yeah,
house policies, right?
yeah,
Like it could have been anything. I know for me growing up, like I had to be back in the house before the street lights came on. That's policy. That's
yeah,
law. You know what I
that's
mean? And
policy.
so exactly. And so I think, like I said, I think it sometimes when we talk about policy, public policy, it can seem like so sort of like broad and kind of like far away, but
Yeah.
it's the rules that we each live by in any given container. There are rules, there are policies that are guided by social norms. And yeah, so that's the sort of work that I do.
Wow. So, how did you get into it? Did you just fall into public policy, or was it like a winding road to like, here? Was it like day one out of the womb, I want to be a public policy
Absolutely
researcher?
not. Absolutely. Day one out of the womb, I didn't know what public policy was.
You know,
No, day one out of the womb, I'm pretty sure I wanted to be a high school math teacher.
really?
Yes. And then maybe like day three, I wanted to be a physician.
Okay.
So
Yeah.
that right, okay. So it's like okay, I kind of see
Yeah.
how we got here. So that was really
Mhm.
what got me started in this like world of health. And I went to college with that on my mind. I was pre-med. I was like, I'm gonna be Dr. Ford, but with an MD behind my name. That was the
Right.
goal, right? And when I was in college, I had an experience where my grandmother passed away. And the circumstances surrounding her death were just very painful for me because she was not treated well. And she didn't need to die. Like it didn't have to be like that. And
Mm.
it honestly really kind of like messed me up emotionally. And it had me in a whole like whirlwind. I was like, I can't be a physician if like this is how this goes. And like, I was like, if I'm a physician, I can only help one person at a time. I was like, I need something where I can help multiple people at the same time. And then that's when I learned about public health because I had never even heard of it. I was in my freshman year of college, and honestly, even in my freshman year, I still didn't know what public health was. I just knew I had this mindset of I want to do something to help big groups of people at the same time in terms of their health. So I switched away from being pre-med. And when I was in undergrad, I was a human and social development major on the community track. And so in that major, we learned a lot about community-based organizations and community-based work and that sort of thing. And I also was a double major in economics. So that was sort of my training, my education. And then when I was heading into my senior year, and this is kind of like, I don't know, I'm aging myself a little bit because when I was heading into my senior year, we had a public health major added like at my university. I went to the University of Miami in Florida. And
Oh,
like this was a time when like there weren't just like public health majors. Like I feel like now just every school has a public health major. That wasn't a thing. Like we literally got the major my senior year. That being said, I was there on scholarship. I was like, I am not about to change my major to public health, but this sounds real interesting. So I took quite a few classes and ended up getting a minor in health sector management and policy. And to be honest with you, I would say that those three combinations of skill sets, so the human and social development major on the community track, the economics double major, and the health sector management and policy minor, that has been my trajectory since then. So coming out of undergrad, I went directly to the University of Illinois at Chicago, where I got my master's in public health in community health sciences. And when I first went, I recently looked back at my personal statement from when I was applying to master's programs. And when I first went to UIC, my whole thing was like, if only we could be culturally competent, if like we could just help to make all of the learning materials in like hospital settings and in clinics be culturally competent and represent the people that are attending those clinics, like that's the answer. That's how we reach good health. You know what I mean? And like, that was my whole thing until I started taking my public health coursework and until I moved back to the city of Chicago and just really started to get this deeper understanding of like how health really was created and how inequality was created and how inequality was consistently recreated amongst the same people in the same communities. And I started to just realize, you know, it's not about these sort of individual or even like clinic-based interventions. Like there is something systematic that is operating here. And it was really those lessons that pushed me into the direction of policy. And so since then, I've kind of been, you know, marrying together public health and also policy work, but always with community at the center of it. Community voice, community experience, recognizing that, you know, you can't know how something is broken until you talk to the people who can tell you how it's broken, right? When we think about any given health policy, you know, we don't know the ways that people are falling through the gaps or being pushed into the gaps until we share power, you know, and build power with those folks and learn from their own experiences and allow them to, you know, be at the forefront of their own storytelling and policy change efforts. So I would say that's how I got here.
Yeah, yeah, it definitely, whenever you said that, it definitely sounds like a similar story that I had. Like,
Yeah.
literally, I wanted to be a doctor too. I was pre-med at UIC. And then I realized, well, I wasn't really in it because I was like, I can only treat one person at a time. And I felt as though I just get bored with just like, you know, doling out the same pills, the same people I see every 3 or 4 months. And I just didn't want to do that. But then I realized I could do more good for the city if I went back to school and just help communities instead of preventing disease and epidemiology instead of treating it as a doctor. So I just you saying that literally just echoes what I believed when I was younger too. I feel like it's a natural calling for public health. Even at UIC where we had public health, we had a school of public health, but like it was so not talked about. Like it was like you were either pre-med or engineering at UIC, and that was where most people were. You were kind of artsy, but I knew very little about public health. But like,
I feel like people don't really know about public health. Like even to this day, like the pandemic let a lot of folks know about public health. People like learned about public health and decided they hate it all in the same few years.
Yep. I remember when before the pandemic, I tell people I'm going to school for epidemiology. They're like, "What's that?" Nowadays, I tell people I'm in school. I'm in epidemiology. They're like, "Oh, I know what that is."
Yeah.
I'm like, I don't know. Is that good or bad that you know that? Like, hey, you know that's good. So, but yeah, no, I think that's a really good story that shows that like sometimes your path toward wherever you were isn't linear. And I like the idea that like for some, like you have the economics, the human relation, I'm gonna say kind of human relations, but also the public health like background. It just all goes into one perfectly. I guess at least from my experience with health policy is you need to know the people, you need to know the money, you need to know the the laws behind it. And that's what it just sounds like it just fit like just like randomly.
It's funny that to you that's like a combination of things that just seems to make sense. Because first of all, this piece about community, that's honestly what I offer to public health work, right? Like, or sorry, not to public health work, to public policy work. That's the piece. And so I'm a mixed methods researcher, but I would say I'm primarily a qualitative researcher. And so this ability to connect with people, to talk with people and to, sit with them as they tell their stories, and then do the work, the interpretation work of connecting their stories to this broader, reality that we all exist in, and then answering the question of what does that mean for policy, right? Like, there is so much value in that. And, just from what you're saying, it sounds like you see the value. And, I spent almost a whole chapter in my dissertation arguing the value of that, right? So I think it's funny that it just kind of clicks like that for you. And I think a part of that is, and so I just mentioned my dissertation. So I guess I should also say that following my master's of public health at UIC, I worked for some years as a policy analyst in the city in Chicago. And then I moved to the DMV area and got my PhD in social policy from the University of Maryland in College Park. But what I was going to say is, a part of what felt important for me as I was pursuing my PhD in public policy was like, I will engage in qualitative work, like, because the numbers just, the numbers just ain't gonna do it for me, because they say something, but they don't say everything. And how can I possibly make sense of what these numbers are telling me unless I talk with people who these numbers are about? And that it made so much obvious sense to me. You're nodding your head. It makes obvious sense to you. And I think that a big part of that is because we represent folks who don't tend to see ourselves or our experiences necessarily reflected in the numbers. So we inherently know that there's more to be known behind and beyond those numbers. So a lot of times in this kind of work, things that just seem so obvious to you or to me, that ends up being the work. It's like proving that.
Right.
So yeah.
Oh yeah, no, that's definitely true. I mean, like, to me, it just all comes together because, like I said, I'm in the public health field, and so this all, and I learned. I got my master's at UIC too, so a little bit of whatever they taught me, what they taught you, is ingrained in me too. So I'm definitely like, oh yeah, that makes sense, and this is true. And I mean, I think also I have a community focus a little bit as well, but also more like an epidemiology standpoint of like, my passion is more into improving the health of our Black community, but with mine is through controlling infectious diseases and educating the public about them. So mine is it's like a different way, but I understand like the need for community to be involved in whatever solution is done, any policy that's written, and the numbers are very cold, and like they don't give the personality to the people that we are giving that the service to or the intervention to. And so I'm definitely that's I love qualitative work. But now that you mentioned your PhD, can you talk about it all, like your experience? Because health policy, once again, another thing I don't know. I don't know anything about health policy and PhD work. So please.
Yeah, I mean, where I don't even know where to begin. So I was in the University of Maryland School of Public Policy, and there's all different. First of all, when it comes to policy in general, there's like all different kind of degree programs, right? So you can be in a public policy degree program, but then there are folks who are specifically like education policy or specifically health policy, right? And those are different programs. Like even in University of Maryland, they have a health policy PhD, but that's out of the School of Public Health. So that's all of that is a whole thing that, like, honestly, I don't care to get that into, because the distinctions really don't even matter as much as you might think up front, right? Like at the end of the day, we are all ideally working in community with one another to address the inequalities via public policy. So like there's that. But in terms of just the broad doctoral experience, I want to give broad strokes because like I know that different PhD programs are different, but just to say, because I didn't really know how any of it went at all when I first like applied. So I want to just give folks some broad strokes. So I applied to my program, and part of the whole process of applying to the program is first, looking at different schools that have people that are there that are doing the kind of work that you might kind of want to do. And I say that very loosely because you don't really know. Like when I first went into my PhD program, I kind of thought I might want to do some work studying unions. And I'm still interested in unions, but ultimately my PhD and my dissertation work, I was focused on studying subjective well-being. So from unions to subjective well-being, right? It's a very, very different ending point. But ultimately, I was able to work with the same researcher, with my advisor, and she was able to, I was able to move with her. She was able to move with me, like on the topic. So anyway, step one is finding a school that has researchers that you would be interested in working with and that they would be interested in working with you, reaching out, finding out if they're taking PhD students that year that you're trying to enter the program, getting all your application materials together, your letters of recommendation, your you might need like a research statement, your personal statement, like all of those kind of things. But once you're in the program, usually you have sort of like set coursework that you're taking with your cohort. And then you likely will have some type of like comprehensive exams. And those are just exams to kind of ensure that you're learning certain core competencies that are going to be relevant to whatever degree program that you're enrolled in. And then once you take all of your coursework, pass all of your comprehensive exams, generally you've got a prospectus or a thesis, whatever it might be called. And that's like mini dissertation, right? Like that's like step one of a like, hey world, I've got an idea and I think it's new and good. And like, can I research this? Like, is that cool? And then you get your committee together and then the committee is either like, yeah, that's cool. Or they're like, nah, you need to do a little bit more something. But once you pass your thesis or your prospectus, then it's dissertation time. And you get started with either collecting new data or analyzing your data and working on your dissertation. And you write it, you gather your committee together, you defend it, and then folks start calling you doctor after that. So that's kind of how that went, at least for me. And those are the broad strokes of like what that process was like. So yeah, I don't know if you have like more questions beyond that.
Oh yeah, I mean, shoot, I'm interested in. I'm interested in going back for my PhD, but I'm trying to keep it light and stuff like that. So generally, like you said, what was your PhD or what was your dissertation in?
Yes. So my dissertation, I already said that I studied subjective well-being, but really my dissertation applied intersectionality theoretical framework to the study of subjective well-being in the US. And when I say subjective well-being, it feels important to just say again, I come from the public health world, right? So I come from the world of health as an outcome. And you and I both know that like there's so many different ways that people understand health. A lot of times people will understand health to mean your physical health. Even more often, I think now people will understand health to include physical and mental health. And then we're also sort of, pushing in a broader direction where people understand health to be sort of inclusive of so much more than just like sort of these physical or like biological things that are operating. And in that way, subjective well-being is a measure that gets at sort of this broad idea of health. So subjective well-being ultimately is your own self-reported version of your quality of life. It's your idea of how your life is going. Subjective well-being is a life that matches an individual's own ideals. And so the sort of measures that I look at when I study subjective well-being are things like life satisfaction, optimism, and stress. And the way that subjective well-being can be understood is kind of similar to how the social determinants of health can be understood to be impacting health, right? So like when it comes to subjective well-being, there are some key factors that shape our ability to be well. Things like our health, again, right? Things like our physical and mental health, relative health status, whether we have health insurance, stuff like that, right? That is our key determinants of our subjective well-being. Other key determinants are things tied up in our money, right? Like our income level, our financial security, right? Like your ability to pay for food and things like that. Our key determinants of our subjective well-being, factors like our social support that we receive, factors like our housing quality, all these different things. Like, and it's like when I say it, it makes sense. Like, yeah, that would impact how I think about how my life is going. Like that makes a lot of sense. So those are in like the literature, in the subjective well-being literature, those are considered key determinants of subjective well-being. Those are the things that like researchers know it takes to be well. So in my dissertation research, I saw this quantitative paradox that looked like it was happening, right? So when I looked at the quantitative subjective well-being data, when I looked at the data, at the quantitative data for what it takes to be well and for the outcome of subjective well-being, and I looked at this by race, gender, and class, I found that for Black women in every income class, we did not have the highest level of like the things that it would take to be well, right? So like we weren't the most financially secure. In fact, we were the least financially secure, right? We weren't the healthiest, right? And in some categories, we were the least healthy, right? So in some categories, we were the most likely to have diabetes, right? Or things like that. But yet we had the highest optimism level, right? Like we had significantly higher levels of optimism. We were less stressed than white people, although more stressed than Black men. And so it was just, you know, and we didn't like our subjective well-being outcomes just didn't seem to match our objective experience. And so for me, I'm like, what's going on here? Like what's happening? And so as I'm like digging into the literature, I'm seeing that the way that people tend to understand what's happening here is through this explanation of resilience. Like, oh, you know, Black people are resilient, women are resilient, you know, that's what's going on. Like that's how the like not having the things you need to be well are translating into these, you know, higher levels of subjective well-being. Like that's the answer. And me, a Black woman, I was like, that just don't sit right with me. Like that feels like an incomplete explanation. And so therein lies my dissertation work, right? So the first step was really naming that quantitative subjective well-being paradox. And then from there, doing qualitative and mixed methods work to try to dig into what's going on here. How are Black women understanding this paradox? Like, how are they responding to this paradox? And so in my research, I actually found this really interesting theme trying to make a change. And that's an in vivo quote, which I'm getting all into the qualitative research like jargon, but an in vivo quote basically, or code basically means it's a direct quote from the participant. So we're using their own words to describe these phenomena. And so this quote, it was trying to make a change, and it basically described these multiple interventions, these multiple individual interventions that these women described taking to intervene on each of their key determinants of well-being. So the actions that they took to intervene on their health, to intervene on their money, to intervene on their support, to ensure that the racialized and gendered factors that exist in our society, basically to ensure that gendered racism didn't shape poorer outcomes for them, right? So one example that I can give is in the area of their money. So there were conversations, their money and their financial security, there were conversations that the women were having about, okay, there's a race gender pay gap. And they talked about it. They talked about their experiences of it. They talked about knowing that they had colleagues who did the same work as them, and because they were a white man and they were a black and they were a Black woman, that person made more than them just for off rip doing the same work, things like that, right? So they were naming these systematic inequalities that exist in their lives, and then they were saying, this is what I do to intervene on them. So there were some women who talked about collectively organizing with their with the people that they work with to advocate for higher wages. There were some people who talked about code switching, or, you know, trying to behave in ways that made their white majority white, colleagues and coworkers feel comfortable. And so these were ways that women described sort of intervening to try to address this race gender pay gap, right? So in this conversation of code switching, the women were talking about, that's just what you got to do to keep your job, to go further. You have to code switch in order to remain in the position. When it came to their health, there were conversations of women talking about doing so much research prior to the healthcare visit in order to show up armed with information so that they would be received in a certain way by the healthcare provider and hopefully treated better as a result. So just each of these individual interventions really highlighted the way that these women could identify, they could directly point to how gendered racism and other systems of oppression were operating in their lives. And they could directly point to how it would negatively impact them if they wouldn't be doing these interventions. And so ultimately my dissertation research, my kind of like answer, the thing that I found was this: trying to make a change. What I found is that individuals are intervening to support their well-being in a way that policy could and should. So that was the big thing that came out of my dissertation research. And then the other big thing would be that, it matters to apply intersectionality theory to the study of subjective well-being. There are things that can be learned, and not just subjective well-being, really to any given policy relevant topic, because there's so much that can be uncovered and so much that can be learned when we really get nuanced and we really get specific and we focus on the systems of oppression as they're operating and how they're shaping differential outcomes for individuals.
Wow, that's fascinating. Like, I'm just thinking about it now. Like, that's really cool. Like, I'm thinking about the part where you're talking about like the trying to make a change and like how the numbers don't match up, but like Black women are still, have the most, the highest level of, the subjective health. And I think that's really cool research. It's something I never heard of. Like, literally, it hasn't like been really talked about. I've never heard of subjective level of health.
Subjective well-being.
Yeah, subjective well-being. I've never heard of that. I think that's really cool. So, what do you do now? As your day to day, like, is it part of like subjective well-being, or you integrate what you've learned in your schooling and your brilliant research dissertation into what you're doing now in the field?
Yeah, so currently I am working as a postdoctoral fellow at the Brookings Institution. And so my work there, I am working to get my dissertation research published, is what is a big part of what I spend my time on. So published as in like in peer review journal article spaces, which we could have a whole other conversation about just research dissemination and where it ends up and who has access to it. I've got a lot of thoughts, Alex, but we don't really have time. Right. But that's what I'm spending quite a bit of my time on now. I'm also partnering with folks at the Brookings Institution to gather new qualitative data with Black people living in majority Black cities to understand how racism is devaluing the assets in their cities and how those assets could be supported, could be built up. So that is a big part of the work that I'm doing. I also am working with a researcher on a project out of Cornell University where we're working to apply a framework for assessing racial equity in health policy. And so we're looking first, so the researcher I'm working with, her name is Dr. Jamila Michener. And so this framework that she had come out recently, the REAP framework, Racial Equity and Policy Framework, it goes through this series of just key considerations and questions to consider when it comes to thinking about, is this policy racist? Everybody wants to know, not everybody, but we're starting to get to a place in our society, where a lot of people are wondering, like, is this policy racist? How do I know if a policy is racist? And, people want a simple yes or no question. And the truth is that, it's all a little racist. And
Yeah.
also the truth is that it's not that simple. It's not that straightforward. It's complicated, it's nuanced. And so the framework is really built to be responsive to the nuanced nature of racism and how it embeds itself in public policy. And so, so the work that we're doing now is like a series of writing pieces that help to explain how to use the framework and how to how to use the framework, how to understand how to apply it to various policy issues.
Yeah, I was thinking about it in public health when back to my master's program. Whenever we asked the question, or at least the most common phrase, the phrase we all probably hated the most was "it depends," and it's
true. It gets more and more true as time goes on. It depends. Like, my favorite thing to say at this point, because it depends gets on people's nerves. My favorite thing to say at this point is, it's all true. It's all true. It really is, though, right? Like, and it's just, I will say that is one of the most valuable lessons that has come out of qualitative research for policy for me, is realizing the extent to which it is all true, right? Any given reality that you can think of that shapes public policy views, like, that reality in that person's head and in that person's life is true. Right? So if you think and a part of the work of the qualitative researcher, a part of the work that I do, right, is sitting with you in that truth, right? And like figuring out how that truth maps on to this other truth that someone else is sharing with me, right? Which maps on to maybe a quantitative truth that might also exist, right? Like, that's a part of the work, but it's all true.
Yeah, I can see that. And definitely, like, I don't like getting into, I would love to get into philosophical meta level territory, but I definitely feel like our realities shape policy. Like, everyone's individual realities affect how we create policy, how we influence policy. And so it's all true based on our own perceptions of reality. And like I said, I'm not trying to get too meta into it, but it's definitely
but say get meta, because it's facts. And like, that's the thing also for me. So to this point of like things that seem obvious, another thing that has always seemed obvious to me, but I have realized that like it's not to everyone, but this idea that like we are all people with biases. So like, Tiff the researcher, Tiff the policy researcher, I am a human with biases. Any politician, any researcher, any policy researcher, any human is a human with biases. And so what does that mean? It means that it shapes how you show up. And in the research space, it means it shapes the questions you think need to be asked, the way you think you should ask them, the variables you think you should measure, like, you know what I mean? Everything. It shapes the methods that you think matter. So the fact that I showed up to my PhD program knowing that like my dissertation would have qualitative data as a part of it, that's a part of my own bias, and that's a part of how I showed up to the space. And people don't take that nearly seriously enough. Again, talking about spaces where I spent some time in my dissertation, I spent a whole little chunk talking about that because it's critical. Because when we don't accept that we are all humans with biases, it means that all of our biases end up going unchecked. We don't name them, we don't check them, because we don't have any, right? I'm an objective researcher. No, you're not. Nobody is. There's no such thing. Right. Impossible. And the way to move towards objectivity is to name your biases.
I like that. It's definitely that needs to be, more talked about. Like, definitely you try, like, it's impossible. Like, you try to be, I've been in research projects where you try to like go into a qualitative study, like, and you kind of ask questions, you develop your research based on the responses you get, is trying to be as unbiased. But even then, you're coming in with a bias. And so it's definitely true. But about being, there's no such thing as unbiased anywhere because we're all shaped by whatever we grow up with. So I got a couple questions left. I'm curious about like, so all this work that you're doing it's amazing. Like I love the fact that like, especially just throwing intersectionality into anything. I think there needs to be more. We need to just dump as much intersectionality we can into things, in my opinion. That's me. That's my bias.
I appreciate it. Like, that's my bias. I
Right.
agree.
That's my bias.
Folks don't know what you're talking about half the time when you say intersectionality theory, but
true. Yeah, I'd be like, well, okay, let me go back and read this. So, but yeah, so what are some of the challenges in your career that you've noticed so far? You know, being in health policy research, or some of the things that, yeah, I guess I'd say challenges, struggles, or things that affect your day to day.
I mean, there's plenty of challenges. I think first and foremost, I am a Black middle class woman who studies Black middle class women. So all of the same inequalities that those women face, I tend to face those same inequalities, right? Like, so I think that there's that, right? When we talk about gendered racism and when we talk about being a Black researcher doing this work, like, I do this work because this is my life too.
Yeah.
Right?
Like,
I mean, so in that way, like, if we're talking challenges, like, challenges of, I used to call it imposter syndrome, but I have come to understand imposter syndrome as like, no, it's not imposter syndrome, it's racism. Yet again, right? It's the environment not being welcoming, right? Being created in a way that makes me feel unwelcome, right? That's not, I'm not taking that as if I have some type of, syndrome or anything like that. But that being said, right, that's a thing, feeling unwelcome in spaces, not just because of how I look and how I show up, but because of my ideas. And I think that anytime you are challenging the status quo, it can be difficult and threatening. Every time you challenge the status quo, it's difficult and threatening. And I challenge the status quo a lot. Not just in terms of my ideas, like I said, but like literally physically. So like I've taught classes and I know for a fact that some of my students were like, girl, what? Like, you the teacher, for example. And that was difficult to sort of establish a level of comfort and feel comfortable and confident showing up in different spaces. So I would say like just that in general is a challenge. But the bigger challenge is on the idea front. Like, I think I receive much less of a challenge of showing up as myself than I probably would have expected. The biggest challenge is having real, deep, direct conversations about systematic inequality and what we do about it. And what we do about it, right? Because, and as my career has gone on, I guess, the challenge has shifted, because the challenge used to be saying racism. That used to be the challenge. Now everybody want to say racism. Everybody want to study racism. Everybody want to know how things are racist. What are we doing about racism? Now that's the challenge. People don't want to entertain serious conversations, for example, about reparations. People don't want to entertain serious conversations, for example, about police and prison abolition, right? What are we going to do about it, right? Now that's the new challenge. And so, and I just want to say, like, to even say that to you right now, because I think I haven't said it out loud like that before, but to say it to you like that is kind of exciting to me. Because like the challenge could still be saying racism.
Yeah.
Right? No, like that could still be the challenge. And so part of me is like, okay, like progress is happening slowly but surely, because it was a challenge to say racism. What was that? Maybe 2016?
Yes.
And it's 2022 and we're having entirely different conversations. So I don't know. I know you asked me about challenges, but now I'm excited to name some progress along the way.
No, no, please. Yeah, shoot, I could definitely ask about the progress
Well,
that
no,
you're
don't
seeing.
ask about the progress
Okay.
now. Don't like just
we, we could probably go on forever. And like, uh, so much I want to ask because I'm a person that just asks every question about everything, and so I guess for the sake of time, I'm probably going to cut that one a little bit short. But
I was
my
gonna
last
say, yeah,
question
don't
for
ask
you,
about the progress because that's a hard one
yeah,
to answer.
right. So my last question, trying to leave it on a good note. So what makes it all worth it to you? Like waking up every day. What do you look forward to in your career and what you do?
What makes it all worth it? I mean, okay, so now this is gonna sound corny, but the first thing is that little bit of progress that we just
Yeah.
talked about, right? Like
Yes. Yeah. Yeah.
that is one thing that makes it all worth it. I think that that's not the main thing. I'm gonna come back to the main thing, but I just on this point of like a little bit of progress. Like I think that the most important thing, one of the most important things probably that you can do as like a public health, public policy, like researcher, advocate, like someone who is operating in my space is like redefine your idea of success.
Yes. Yes.
Because like we live in a racist society, right? So if your like life's work is to just like entirely undo racism, like you like ain't gonna be no racisms by the time I'm done, right? Like that's
Right.
that's a hard thing, right? But to be a part of the movement of people who are slowly but surely pushing back and changing the way that we talk about racism, changing the way that we think about racism, changing the way that we respond to racism, like to view a win through a different lens feels important, and it feels like the key way to like ensure that you're getting some type of like gratitude at the end of every, I'm not gonna call it day, but at the end of every quarter, end of every year maybe. But the number one greatest thing that makes it all worth it for me is community. It is being in community with people. It is the joy, the fullness, like the love that comes from being with my people. And my people can mean so many different things, right? When I'm back home, my people is my family. But also when I'm back home, when I'm in Chicago, like my people are my public health people, the people that be in the streets fighting for justice, right? Like those are my people. And that is joyful to me, that it reminds me that there is a reason that we're doing this work, right? The reason why we're doing this work is you over there and you over there and you right here, right? We are the reason why we're doing this work, and your joy matters and my joy matters, and we're going to keep pushing so that we can all experience our highest levels of health, our highest levels of well-being, and ultimately our highest levels of joy. So I feel like that's what makes it worth it to me when I consider all the little girls who might want to do this work one day when they see me doing the work, right? Like those are the kind of things that like bring me joy and make it feel worthwhile at the end of the day. Because this work is heavy, reading about systematic inequality, and especially like we already kind of touched on, reading about it when you also can see yourself represented in those experiences, it gets so heavy. But the thing that lifts me up every time is the joy of community.
Wow. That was really powerful. Like literally thinking about all that, and it I can definitely see why you get excited about it all. Like I'm thinking about it too. Like I said, I'm reflecting as well as you're talking. I definitely feel the same thing about what I do. Helping my community is probably the makes it all worth it for me too. It's just definitely like seeing that I feel like I'm making an impact somehow, and I'm leaving it better than where leaving it better than where I came in. So
Mm, that's
um,
always the goal.
yeah. So, yeah, I want to, like I said, that's pretty much all of my questions. So I want to say once again, thank you to all the listeners and watchers of our podcast, and we'll be back soon with another episode. Thank you, Dr. Ford, for coming
Yay.
on tonight. This was a really great. The conversation was great. Like I said, I could just talk forever and ever about this, but with the interest of time, thank you for coming. I really appreciate it. For all of our listeners, if you're interested in health careers, contact us, either YHP or AHEC. We can definitely direct you toward anything when it comes to health careers. And with that, stay safe, everyone.